Hello, this is Kathy Bukowski, the owner of CB Health Insurance and the CB Health Insurance YouTube channel. And today's video is going to talk about the changes for Medicare in 2021. So stay tuned, but if you haven't done so already, please be sure to subscribe to our channel, click the little bell so you get the updates and you know when our next videos are coming up. Now, on to the changes for Medicare. There's a couple of components to Medicare, and one is the premiums that people pay. The second is the deductibles and out-of-pocket. So for starters, Medicare Part A, for most people, has a zero premium. If you've paid into the system, paid Medicare taxes for 40 quarters, you have a zero premium. However, those individuals that have only paid 30 quarters, the premium for 2021 is $257, and if you've paid in less than that, it's $471. Now, Part B does have a premium, and for most people, it's the standard premium. If your income is above a certain level, then you could pay more, but that standard premium for 2020 was $144.60. In 2021, it's $148.50. So that is an increase about $3.90. However, the Social Security adjustment, on average, people's income went up about $20 a month. So it's less than the increase for the standard of living for Social Security retirement. Now let's talk about the deductibles. There's Part A, which is the hospital, and there's Part B, which is the outpatient. Part A is anything in the hospital, any inpatient hospital, and there is a deductible. The deductible for 2020 was $1,408, $1,408. For 2021, it's going up to $1,484. Now, for those people that buy a supplement, most supplement plans are going to pay that, so you don't have to worry about it. If your supplement says it covers the Medicare Part A deductible, it's going to go ahead and adjust whatever that happens to be. And every year, by the way, the government doesn't increase this. So as long as you have a plan that covers that, you don't have to worry about that increase. Part B deductible, however, is not covered by all the supplements. If you have Plan F, which was available before, or Plan C, it will cover that. However, anybody that's new to Medicare starting 2020 or later cannot buy those plans. So they are stuck paying that deductible. The deductible for 2020 for Medicare Part B, that's any outpatient services. That's going to a doctor, having tests done, anything done on an outpatient basis, really. For 2020, it was $198, and that's a one-time per calendar year deductible. For 2021, it's gone up to $203. So once that's met, Medicare is going to pay 80%, and a lot of supplements out there will pay 20%. There are a couple of other changes, some that affect everybody and for the better. Medicare did announce that they will cover, CMS said that there's going to be no out-of-pocket cost for anybody that needs a COVID vaccine. So it should cost you nothing, $0. If most people don't have just Medicare alone, they need some sort of drug coverage, so you can get that one of two ways. You either do a standalone drug card, and most people buy a supplement, or you do a Medicare Advantage plan. The Medicare Advantage plans are subsidized government plans. This is Medicare Part C. You do have to enroll in the fall to get in them, but the government kind of has guidelines in terms of how much is the maximum out-of-pocket. The maximum out-of-pocket for 2021 cannot exceed $7,550, which is a bunch. But most people, when they're buying a policy, they'll look at the summary of benefits and they'll know in advance, and it can be less than that. But that is the maximum set by law. Also, the government does regulate the standardized Medicare supplement policies. There's a couple of policies known as high deductibles. High deductible Plan G and high deductible Plan F. Those high deductible Plan Fs are available to anybody that's turned or became eligible for Medicare after 2020. But I did do a video on high deductible G. If you're interested and want to know, go back and watch that. The deductible for high deductible F and G for 2021 is $2,370. And again, that's set by the government. That's indexed up every year. And last but not least, a couple years ago, they added Plan K and L, Medicare supplements, K and L, and these introduced, they have like a 50-50 co-insurance, and they do have a maximum out-of-pocket. For 2021, that's going to be $3,110 or $6,220. So those are the changes for Medicare for 2021. We hope you enjoyed this video. Please feel free to share it with family and friends. And if you know anybody that is turning 65 this year, check out our channel. Make sure you just subscribe and stay tuned for the next one. Thanks for watching. This is Kathy Bukowski, the owner of CB Health Insurance.